What an amazing conference. Thanks so much for the invitation. It's a real privilege to be here. I'm going to start off by telling you about a time when I was strangely happy to be referred by my GP for a heart stress test. See, I'm a heart researcher. It didn't intimidate me, and I had no symptoms. I had no risk factors apart from being a 42-year-old man who liked to have an occasional social cigarette with my friends when I was out. But I remember very well in the bright room, electrodes across my chest, and as the treadmill sped up and rose, I was joking with the cardiac physiologist. We were having a laugh. And even as I started puffing and sweating, I thought to myself, oh, I could do this. I should really try and get fit again. I was actually having a lot of fun. Right until I found it difficult to talk. And the cardiac physiologist went quiet. And she said to me, do you want to stop? And I lied. I said, no, I'm fine. And a couple of moments later, she stopped the test anyway. And the room went quiet apart from the sound of my heavy breathing. And when I eventually could ask her, I said, what's wrong? And she said, you need to talk to the cardiologist. So a little while later, I found myself in a room with a cardiologist where he recommended really aggressive treatment, more testing, and gently, even I would say kindly, suggested to me that I needed to maybe get my affairs in order. I could feel the walls of the room closing around me. This is not how I saw my 42-year-old self. It took me a few months to realize just how lucky I was. I got great care. Years later, I'm doing really well. But many people don't get the same opportunity or early warning about heart disease for two big reasons. One, they don't have the right postcode. Where you live is one of the best determinants of where you're going to, or how easy you're going to get access to healthcare, and even how long you live. And we heard that this morning as well from Eva. But also, they're not men. If I was a 42-year-old woman, even today, with no symptoms and no risk factors and no private healthcare insurance, do you think the story would have been the same? There are more women on the planet today with heart disease than men. Heart disease is the biggest killer of women, 1 in 3. And yet bias and sometimes marginalization means that we think of heart disease as a problem of men like me. Pregnancy complications and menopause are often forgotten as risk factors for heart disease, and they are. And when women with heart failure present to the system, they're usually 3 years older and with much more severe disease than men. But everybody should know their numbers. Blood pressure, blood cholesterol, blood sugar. Just out of interest, hands up here, who does know their numbers? That's quite good. I'd say probably about a third of the room. Some of you might be like my friend Emma. She's 56, she's working hard, she's sandwiched between teenage kids and elderly parents, and her cholesterol is high, which her GP puts down to the menopause. And when I ask her what her numbers are, she says she doesn't know. She's not concerned. She's got other things on her mind. And her GP's not worried either. Now, Emma has more or less the same postcode as I do, so the main reason that I can think of that she hasn't either sought or been offered treatment or maybe more testing is that she's a woman. And do you know that pregnancy is like nature's stress test on the heart? And that's why heart or pregnancy complications are often indicators of future heart risk. Mary, in her 60s, has had 16 pregnancies, 9 of whom she tells me have survived. And on top of that, Mary probably doesn't have the right postcode either. She's a traveller. And traveller women in Ireland, as we heard earlier on, live 10 to 15 years less than the average. Another woman with the wrong postcode is Gertrude. She was born high on the plains of the East African Rift Valley overlooking Lake Malawi. And when I met this inspiring 65-year-old grandmother, she had survived a war of independence and famine to end up with premature heart failure because of long-standing, untreated high blood pressure. But she tells us that she's had a good life. She's lived much longer than many of her friends and than the average woman in Malawi, which is 20 years less than the average woman here in Ireland. And her heart failure could have been prevented easily and cheaply with medication. None of these women had the good fortune of my 42-year-old self. So why don't we talk about heart disease in women more? What's at the root of the problem? Well, maybe imagine for a minute a heart attack on TV or cinema, the so-called Hollywood heart attack. You know, the expression of shock and strain on the face, and can't talk, and sweating profusely, gripping the chest, or maybe the arm and then keeling over. Are you picturing a man? Because the Hollywood heart attack nearly always happens to men. And last week at the Global Heart Hub Summit, which is held here in Dublin on women and heart disease, many women from around the world stood up and told stories like Emma, Mary, and Gertrude. And the cardiologists that followed began their talks one after another by just apologizing for the stories that they had heard. Stories of people being ignored and dismissed when it comes to their heart health because they're women. One of the cardiologists told us, well, cardiology is a male-dominated profession. And if that's part of the problem, and it may be, Ireland has the lowest proportion of publicly funded women cardiologists anywhere in Europe, at less than 1 in 10. And if you're waiting for heart researchers like me to solve the problem, it's going to take too long. Because good science moves slowly, especially medical science. In Japan in the 1990s, a young researcher published on images of hearts that looked like Japanese octopus traps, called takotubos. The hearts were failing. They were swollen, they were oval-shaped, they were stiff, just like the fisherman's traps made of ceramic. But it took more than a decade for this story of takotubo heart failure to arrive on the shores of Europe and America, where it became known as broken heart syndrome. In the case of the original report, and in general, it nearly always happens in older women. Not exclusively, but nearly always. And I can only find one TV representation of broken heart syndrome in the TV series House from 2013. Would you be surprised to know that it wasn't represented by a postmenopausal older woman, it was a young man. Good science moves slowly. And sometimes I feel very frustrated by the pace of change. Bethany Wong is a young cardiologist and heart researcher, and we worked together for more than a year now on a study of the differences between men and women's hearts. And just earlier this month, we had a third rejection of our main report. The first reviewer said, this is really important and really timely. The second reviewer said, there's nothing really of interest here. And the editor told us that it was low priority. And they cannot all be right. So there's probably biases in the research system as well. Sometimes I feel like healthcare people are like me, are frogs in a pot of boiling water. The temperature is slowly rising, but only some are beginning to notice. I think that bias in our hearts starts in our heads. And I think if we're going to change the story for Emma and Mary and Gertrude and people like them, we're going to need more than science. We're going to need awareness, we're going to need action, and we're probably going to need new stories. In 2024, my really good friend Joe Gallagher, at the back of the room, who founded the Gorey Malawi Health Project, and I teamed up with Fishamble, the new play company based here in Dublin, to tell new stories of health equity through theatre. We call this the Navigator Project, taking inspiration from the ancient Irish mythology of the navigator Cesar, who was said to have fled from the East African Rift Valley because of climate change and a coming flood. Her grandfather had built a big boat, but told her there was no room. Disappointed but headstrong, she and her friends built their own boat, and they sailed up the Nile, across the Mediterranean, up the Atlantic coast of Spain to land at Cartagena on the west coast of Kerry, and become, according to the mythology, the first people to settle on the island we now call Ireland. When I was growing up, nobody had heard of the story of Cesar, but everybody knows the story of her grandfather, Noah, and his famous ark. And Cesar's story reminds us of the ancient connectedness of people. That on an island like Ireland, all of our families are like immigrants in one way or another. And Cesar died of a broken heart, but it took thousands of years and the story of Japanese lobster pots for the science of broken heart syndrome to land on the shores where she lived and where she died. And because good science moves slowly, there's value in storytelling and there's wisdom in storytelling as well. So the Navigator Project has commissioned 4 playwrights so far to tell stories of health equity with our health researchers. Maybe modern-day navigators like Mary and Emma and Gertrude. We hope to tell a new story about women's heart health, that women's hearts are not just smaller versions of men's hearts, that their need for care and protection is every bit as big. I've got 10 seconds. So, 1, don't be dismissed by your gender or your postcode when it comes to your heart health. 2, find out and know your numbers. And 3, if you have to, remind healthcare providers of pregnancy complications and menopause. If you get a chance, have a look at navigator-project.org to find out about our work, and tell your friends, your partners, your mothers, your daughters, and even yourself a new story about protecting women's hearts. Gorey Malawi.